AMA and then CMS worked together to come up with these codes. And it has to do with a larger initiative. It's been going on for several years now, where basically CMS recognized that in order to provide better care to patients and to lower costs of healthcare overall, they needed to come up with a way to better compensate primary care physicians for coordinating that patient's care. What they ended up with, and you know yourselves, the healthcare we have in America is very fragmented. A lot of specialists, a lot of things going on. One provider is doing something for a patient. The other provider doesn't know what's going on. We get a lot of duplication. And then another issue is then the readmissions. We've got patients receiving care in the hospital when if they've been provided the appropriate care outside of the hospital, that hospitalization wouldn't be necessary and readmissions wouldn't be necessary. It's kind of interesting reading. I've given you the website to go and read some of the reports that have come out of this initiative. One of the interesting things is that the AMA said, wait a minute, we already have great codes for things like care management, phone calls, email, internet access. We already have codes for that, but CMS was pretty adamant that no, we don't like those codes, we don't like those ideas, come up with something new. So in the last few years, we do have these two new concepts, transitional care management and chronic care management. The idea of preventing readmissions is the primary force behind the transitional care management codes, because so many patients go home from the hospital and they're better than when they went in, but maybe they're not at 100%. They're not able to care for themselves. There's a lot of things that fall by the wayside, and they end up coming right back in the hospital. There's also always that little bit of hint or even an allegation that maybe they were sent home too quickly. So hospitals are actually penalized for readmissions within 30 days. So we're looking at how we can prevent that, how we can get this patients receiving better care to keep them out of the hospital. Now, we are assuming Medicare as we discuss this, because a lot of the coverage requirements are specifically from Medicare. I am going to discuss the CPT guidelines as well. So we're talking about Medicare, but this may also apply to other payers. It may also apply to other practices such as pediatrics. I spent a day with a pediatric practice a couple of weeks ago just going over all kinds of coding and billing. We actually talked about both of these codes in the pediatric world. So it's not just Medicare, although we do have to share the Medicare guidelines kind of as our basis to go from. So first, let's talk about transitional care management. And let's look at slide 3. And I broke this down as to almost like a newspaper reporter looking at the who, what, where, when, why, and how of this service. So first of all, the what. And these two, on this slide, I just have the code descriptions. I'm not going to read those for you word for word, but let me point out a couple of things. First of all, that 2 days. We've got to have that initial communication within 2 business days. We're going to hammer on that in just a moment. And we have 2 codes. One is when that patient requires moderate decision-making, moderate complexity, and one is when the patient requires high complexity. We're going to talk about that some more later.